Welcome to CCM 135 Communications. My name is Mr. Monclova and I'm going to be your instructor for this section. And today we're looking at adapting communication to a patient's ability to understand. This is Chapter 6. Here are the course objectives that we are going to cover today, so feel free to pause this PowerPoint at any point in time to take a look at the course objectives. There are different factors that may impair communication with our patient, and some of these factors can include pain, fear, or anxiety, low health literacy, language differences, visual impairments, loss of hearing, advanced age, and confusion. And we're going to talk about each one of these. Health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So in other words, does the patient understand what needs to be done in order to advance with their health care? Health literacy includes the ability to understand instructions on over-the-counter and prescription drug labels, appointment slips, medical educational brochures, doctor's instructions, and consent forms. We also give patients what we call a home exercise program in physical therapy, where the patient is expected to perform their exercises in the comfort of their home. So they have to be able to understand the instructions and follow them correctly. Most medical literature out there is at a high school level or higher. Sad to say that some individuals with high school diplomas end up with only a 7th or 8th grade reading comprehension. So this can be a little bit difficult in terms of health literacy for those individuals. Health literacy also includes numbers. So in other words, understanding probability and risks, calculating blood sugar levels, measuring medications, understanding sets and repetitions for exercises. So this also comes under the health literacy category. Only about 12% of adults have proficient health literacy. So knowing that as a healthcare provider, I want to make sure that I am able to communicate with my patient appropriately so they understand the process of their care. There are some populations that may experience low health literacy, and these populations can include the elderly, racial and ethnic minorities, people without a high school diploma or equivalent, individuals with low income, those that don't speak English or have English as a second language, and people with chronic diseases. We do find that socioeconomic status has a huge role in terms of health literacy. Socioeconomic status basically means the amount of money an individual makes has a correlation with education. So when individuals are on the lower end of the spectrum on socioeconomics, chances are they may not have completed school and therefore they only work just to support their family, versus others with higher socioeconomic status. They've gone to school, they are very educated, and they have good jobs, may understand health literacy a little bit better. People with low health literacy are more likely to overlook important preventive measures. So, eating right, taking care of your body, exercising. They may have chronic disease and be less able to manage their care effectively because of the disease process is so advanced. They enter the healthcare system when they are very, very sick, versus recognizing the onset of symptoms and seeking care sooner rather than later. And they tend to go to the emergency room and be hospitalized more often. Those with low health literacy tend to have a lack of health insurance. Sometimes they have this shame regarding their lack of skills and may hide their difficulties to maintain their dignity. They're more likely to be non-compliant with doctor instructions, and we see this in physical therapy as well, especially with home exercise programs. Some patients may not see the value in it, so they're non-compliant with their home exercises. And they may have poorer health outcomes and higher healthcare costs as a result of this. Here's some strategies to communicate and interact most effectively with patients with low health literacy. And this would include evaluating the patient's understanding before, during, and after the introduction of information or instruction. So when we see a patient in clinic, our job is to assess the patient's knowledge base and assess whether or not they understand what the process is. We want to try to limit the number of messages given to the patient at any time. Keep things very simple, keep things bullet pointed, and that seems to help the communication process. And we always want to use plain language with communication. So we don't want to use medical jargon or really fancy $10 words. We want to use plain language that the patient can understand. Plain language is characterized by information that's organized so that the most important points are delivered first. So the major stuff that we want the patients to know, we'll usually present that at the beginning. Information is usually broken down into little bits so it's easier to digest. And we want to keep language very simple and clear and define any medical terminology. It's okay to use medical jargon as long as we define it for the patient and the patient understands what that medical jargon means. We can also supplement instructions with pictures. Again, I go back to home exercise programs. I like to print pictures of the exercises that the patients can do at home, and it's for easy reference. They can look at the pictures and know what they have to do. We can tailor medication schedules to fit a patient's daily routine. Now, that's not part of our job in physical therapy because we don't deal with medications, but it is part of health literacy and communication. We want to prepare written forms that are at a lower level of reading so it's easier to comprehend. And we want to provide or serve as a reader for forms or written information if the patient is illiterate. Say if they can't read or if English is a second language, I might have to read the instructions or read the information to the patient as well to get that information across.